placement, that's when you go out onto the ward, and that's when you start to practice your skills and get what you've learned from your academic, from your lectures, and putting them into practice. There's 2 placements a year. In your first and second year, they're 12 weeks each, and in your third year, they're usually 10 weeks for your first one and then 18 weeks for your second one. In your first year then as well, like I said, it's about essential nursing, so this is where you're learning all your foundation skills to be able to go through to your second year and your third year, where you're doing more, how can I say, nursey skills and more sort of technical skills then. In your second year, you'll have a community placement where you'll be with the district nurses, health visitors, and that's where you can have, it's a great opportunity to see what is actually out there when you discharge your patients, and there you get to be able to go on visits, you can get to spend time with midwives, health visitors, different organisations and agencies, and you can go to different charities and different types of nurses, like specialist nurses, like respiratory nurses, cardiac nurses, diabetes nurses, and then in your third year it's more about management. So this is where you have your placement, and you can decide in your third year whether you want an elective, and that's 4 weeks of your first year. You can go anywhere that isn't part of the UE, so you can go abroad, you can go back to where you live if there's a little local cottage hospital there that you fancy, like a little rehab hospital there that you fancy going to. You can go, like I said, abroad, you can go anywhere as long as it isn't in Bristol, and UE sends students there anyway. And that's part of your 10-week placement, and then you'll come back to UE, you'll give a little presentation to your tutor group, and then you'll go back onto either a ward or a community, because you can choose. So you can either have your 10-week as a hospital or a community, or you can have your 18-week placement as a hospital or a community. You can't have 2 communities though, because you've got to have 1 hospital and 1 community. And then you have your 18-week placement, and then that's split up again. So your first 12 weeks is where you're getting everything signed off. So you're getting everything that you need to be able to get signed off as passing your placement. And then the last couple of weeks of your placement, that is where you're just making sure you're competent at everything, brushing up any tiny little skills that need to be properly corrected before you go out and qualify, and then you start your job. Placements, I've been really lucky. I've had really good placements, and most people do. You can be anywhere in a hospital, but like I say, in your second year, it's more specific. You'll have a high dependency, so you'll be somewhere like A&E, you'll be somewhere like theatres where you'll watch some surgery, coronary care unit, so that's where you'll get patients admitted in with heart attacks. You'll be intensive care or high dependency unit. So critically ill patients, that's where you get to learn and assess them, and any critically ill patients, that's where you get to be able to learn how to deal with that, and you'll have your community. But in your first and your third year, you'll be any ward, ranging from surgical wards to respiratory ward, anywhere really. They try and place you in quite as local as you can, but if you apply and they send out all your information, you get to choose what area you want your placements at. So if you live in Bath and you come to Bristol to study and have your lectures, you could go to Bath Hospital. There's that zone where you can decide. So you can decide, so you can either be at the BRI, the main hospital, or you can be at Frenchay or Southmead, anywhere really. You have the choice in that. Types of support on placement, you've got your mentor. She's a qualified nurse who's been on a teaching and assessing course and passed it, and is qualified to teach and mentor students and be able to sign them off as competent. And they've probably been qualified for a minimum of a year, like 18 months. You won't have a mentor before then. Sometimes if it's a really busy ward, you may not be always to work with your mentor, so they'll assign you 2 nurses. You'll have your mentor, and you'll have like a named nurse, and they could be a newly qualified nurse or a nurse who just hasn't done the course, that you can work with for most of your shifts if your mentor isn't on shift, and they'll report back to your mentor. If you do have troubles with your mentor, you've got your ward sister, and they're totally impartial and you can talk to them. And you've also got a practice support line, and you've also got like your personal tutor at university as well. They'll be able to help you as well.